Bismillahirrahmanirrahim. Assalamu alaikum, and once again a warm welcome to another episode of Perspective. Today's show is a follow-on of a discussion that I had with Suraya Nawab, Specialist Wellness Practitioner, National Director of the Muslim AIDS Program, and also the founder and former Director of Islamic Care Line. And when I say it's a follow-up interview, a few weeks ago, she was in studio and we started talking about ageism. We meant to cover another part of that discussion on the show, but time didn't permit it. So that's a very important discussion for one and all. And we're going to be talking about elder abuse. Yes, it is rife, not only in our community, but globally. And we're here to unpack those issues. And please, if you have elders in your home, watch very carefully, take in the advice, take in the points of the discussion and start pondering on it, and maybe you need to start changing the way you interact with the elders in your community, your family, your immediate family, and the type of role modeling that is going on regarding those discussions. But let's welcome our guest, Suraya Nawab. Once again, an absolute pleasure having her in studio with us. Assalamu alaikum to you.
Wa alaikum salam wa rahmatullahi wa barakatuh, and jazakallah for having me back.
Okay, for those people who might have missed our first talk, we covered ageism, and now we're going to talk about elder abuse. Can you just very quickly recap and tell us what's the difference between ageism and elder abuse? Okay,
so ageism, like we identified in the last program, was actually the discrimination of older people, older adults in our community. And that the very clear distinction is made there in terms of the abuse of older people. And ageism, when we look at institutions, for example, when we look at the community in terms of the medical profession, for example, where your age is a determinant of whether you're going to be receiving the treatment that is available, or do they give it to a younger person. So that's that discrimination that we find. And then institutionally also, in terms of older people, how much of regulation is there as opposed to something like GBV. And I don't want to minimize gender-based violence, but what I'm saying is, when it comes to elder abuse then, or ageism, just because a parent is or the person is older, they are discriminated against. Okay, so and as opposed to the elder abuse that we're going to talk about, that is very inherently within community, within family, where there is an abuse of the rights of another person. Whether they're older or younger, doesn't matter. The fact is, in elder abuse, it is about sometimes, very often, their own family, their own kids or nieces, nephews, even grandchildren sometimes who are young adults, can be abusing the older people, older folk in the family. So I think the distinction is that elder abuse is actually perpetrated against a specific person who's older in age, and ageism is about a generalization of older people, and then decisions are made about them, how much their state payout would be, you know, their grants would be, things like that. That is all institutionalized, and oftentimes, even in our country, you find that the SASA grants for pensioners is far less than even a breadline living amount, you know. So I think ageism comes in there where older people are just discriminated against because they've just now reached an older age.
You talk about the SASA grants, and what comes to mind for me is the unfairness and the violation of the rights of older people. And you can either, you know, class it under ageism or elder abuse, but think about the very many older people that we know that have worked all their lives, that have paid their taxes, and now when they are retired and they need the money because the SASA grants are pitiful.
Yes.
It's not more than 1600 rand a
Yes.
month. What can you possibly do with it? If these people don't own their own property, and if they're renting, they've got to pay rentals, they've got to buy food. We know what food costs, transport and medical assistance as well. Where on earth is 16 or 1800 rand? Where does it start to cover those costs? It would also depend on the older person having made provisions for themselves for these type of costs in their older years if they don't have children or relatives to care for them. So it really is discrimination and violation of older people's rights.
Exactly. And so we see that a lot in the and we said earlier that ageism is a new term that is being used more and more often. And I think it's just a global need to try and correct things in terms of society and how we live. So I'm glad that it's including a very vulnerable population group that we experience with every day in our lives, in our homes, and within the community at large. So I think it's a good thing that it's on the table. I just think we should be fair and not to violate their rights, because they do have rights. The fact about the amount that the grants actually, that pensioners actually get, it is a pitiful amount. And exactly as you said, if these older people didn't make any retirement contingency plans for their retirement, they do find themselves in a real vulnerable situation within families. And then obviously, then there are institutions that we would allow our older folk to actually go into, right?
And I think even that comes at a price. Even that comes at a price.
Yeah.
But I think the important question regarding our conversation today on Hilaal TV, which is targeted at the Muslim community at large, is: does elder abuse and ageism perpetrate amongst the Muslim community? And before you respond, you and I spoke about a beautiful hadith regarding the rights of parents and the honor that we as Muslims are meant to be affording our parents.
So I think the hadith is to the effect that a Sahaba came to the Prophet ﷺ and asked him ﷺ, who has a right over me? And Rasulullah ﷺ, at 3 occasions in that same conversation, said, your mother, and who else? Your mother, and who else? Your mother, and then who else? And then was the father. So I also don't want to discriminate between the genders in terms of older people in our families, but that is a very good yardstick, let me say, to measure where our rights as children lie in terms of our older parents or aging parents. And I think also we've evolved as a community as well. So very often today within communities or within families, you'll find the siblings taking turns to look after the parents, older parents who are not working, and also see to their financial needs. There are older people that have been really careful in providing for their retirement, and so they would be okay because they have that bit that they put away for themselves. So whether they need caregivers or whether they need to enter another organization that will take care of them and have all the mechanisms for that care, they can do that by themselves. However, there is a part of the population that in that sort of age group that wouldn't have the retirement plans, that wouldn't have monies put away, finances put away. And so then it becomes the duty of the responsibility of the children, obviously. Then you also brought up another thing in terms of what happens to older folk who don't have any children, okay? So I think that goes back to the relationships that people have in communities and in families. And so very often, and still alhamdulillah, I think in our sort of communities, you'll still find nieces or nephews or somebody to come along and assist. But I think as we go on, speaking about this, an important thing is about the need for facilities where the older folk will be cared for in terms of what they need, what their needs are. And what, as a Muslim then, what are you depriving yourself of? By, you know, we also always hear about Jannah lies under the feet of your mother. And your mother doesn't have to be old to get that Jannah,
True.
but obviously when people are older, then they need you more. So are you looking at that Jannah? Are you going to look after that? Or are you going to say that I'm too busy and I can't do that right now? But,
Okay. Time flies when I interact with Suraya Nawab because we just have so much that we need to talk about. Inshallah, we'll try and cover as much as we possibly can regarding elder abuse in the show today. We'll be back with you in a minute or two. Welcome back. I'm talking with Suraya Nawab. We're talking elder abuse. Please stay with us. It's an important discussion. And of course, we need to really introspect about this issue on the show today and going forward. Elder abuse, we as Muslims believe or think that it doesn't happen in our communities. We honor our parents. Our deen is about honor, respect and love regarding all the people that we interact with. Why are you and I sitting here talking about elder abuse? Is it a problem in our community?
Yeah, so okay, yeah, definitely is. And again, as I alluded to earlier, in terms of how we've evolved as a community and as families and become, I wouldn't say westernized, but very modernized, and that is what life is, right? We go with the flow of what is available to us, and all of us are at some point getting older. And so the question about whether it does occur, abuse does occur in our community, yes, it does. So I've seen it when I used to be at the Islamic Care Line. I see it now in private practice as well. And I also have the opportunity to see it from a different perspective, and that is from the HIV/AIDS program with MAP that we do, where we actually have, I know we're talking Muslim community, but I think this is important in terms of there's actually a program called the GOGOS program, meaning older people who are left to care for younger children because their kids have passed on due to AIDS infections, right? And you see how these older women struggle. And we're talking about people who have earned just basic minimum wage, people maybe who haven't had time to even keep a little nest egg for themselves because expenses and all of that. And you'll see the compassion and the respect that these communities have for these older women, okay? Unfortunately, I think in our community, it's shifted a little bit, and that is why we see an never-ending need for organizations to start frail care centers or facilities where older people can be left to be looked after, to be cared for. And that in itself, as we said earlier, is debatable, because what do? Do you take an older person who you now have the responsibility of looking after and put them into a facility where somebody else will take care of them? Or do you make the necessary arrangements to keep your older mom or dad with you, and then you sort of care for them? I just want to bring in another thing here, and that is the fact that oftentimes with marital problems, you'll find this coming up, that one of the parents have now been widowed or divorced even, or just been alone, and now the younger couple need to bring them to be looked after within their home. And it brings on a lot of tension in the marriage. And so in marital therapy, you see this often, and that is why I've actually started using that scenario in a premarital context. So that when young people are on the threshold of getting married, the furthest thing in there for them is looking after older people, right? But I bring it up in the discussion in premarital counseling in terms of the family interaction. So what would happen if one of your parents now really need you? You're going to be living on your own. Have you thought about this? Have you spoken about this? What would happen if either one of them need to be taken into your home? And it's surprising, despite the modernization I spoke about, young people don't think about this. And I think it's important that they do, because if you look at the years and how quickly the years are just running away from us, before they know it, they'll be married for 10, 15 years, and there's an older person that needs to come into their nuclear family for them to look after. The pros of that, about that, is that the children who grow up in that home, having an older granny, a nani, a dada or dadi, they learn so much. They learn about the value of taking care of the hadith of the Prophet ﷺ, about taking the care, the love that you spoke to, the family unity that we spoke to. Because many times we find that there are very matriarchal personalities who still will not be earning much, who will not be going to work because whatever, they're frail because of illness or they just because of old age, but they still have that authority. And the abuse comes in when that authority is taken away from them. So that it's like your decision doesn't count anymore. It used to, but that decision doesn't. We are now in charge.
We the bosses.
We the bosses now, and so you need to go with your life needs to be directed the way we want it to be.
The other thing as well that I've picked up, and I'm wondering, has this got to do with mother-in-law, daughter-in-law dynamics? And I'm also seeing a lot of families where traditionally it was the eldest son or one of the sons' duty to take care of the older people. You know, as they age, they're not able to take care of themselves for whatever reason, financial and otherwise. So that was an unwritten law or rule within our community. That is shifted. It now seems that the daughters in the family are taking care of the parents, and that could be because of the mother-in-law, daughter-in-law dynamics. And I think that's really sad.
Yeah, it is sad, but I think it's also sometimes circumstantial. Okay, again, I think I want to give the benefit of the doubt to younger couples or couples that are still able to work and go out and play a part in the community and things like that. I think ideally, if the adult children are 2 or 5 or 3, whatever, to sit down and decide with the older person, if they haven't already started dementing and things like that, whether they're still quite compos mentis, they can sit with you and they can have a discussion and they can decide where they want to go. Okay, or do they want to remain in the son's home or would they like to go to the daughter? Ideally, again, if they are able to and they're mobile enough, it's a good thing to ask them to stay maybe a week or a month, whatever the family decides. But as people get older, that's difficult for them to do, to be living out of a suitcase, basically, right? So even if you're going for a month to one of the kids and then you're moving to another place, and it's good for them, environment changes. It's good for the grandchildren because they get to have this very intimate relationship, get to know the nani or the daddy and interact with her and all of that. I remember on the Ageism segment we spoke about the experiment in the Scandinavian countries about older people being matched up with younger kids, so between 5 and 6, 7 years old, and how it just lifted their spirits up and how it just brought back that zest for life for these older people. And that speaks a lot because a lot of our community members, younger couples, and so have these children, right, who are probably our grandchildren now. And then we should try that and that also actually then takes me back to or away from the present topic in terms of what can we do today to stop the abuse of the elders in our community. And one of the things is to try and give them the time with younger children. The kids will learn a lot. Out of respect, they learn about tolerance, they learn about how to hold an older person to help her if she's a bit immobile or struggling to walk and things like that. The different apparatus that they need, whether they need a walker, whether they need a commode, whether they need a heightened toilet pan for, in the bathroom. Kids learn to live with this, and it's so much of value for them in terms of their self-worth, their self-respect. It's something they can always cherish as well.
And it's life lessons for these children as well.
Yeah.
And obviously, if it brings me to the abuse part, and I spoke about daughter-in-law, mother-in-law dynamics. It can even be the reverse, father-in-law, daughter-in-law, or what, whichever configuration we're looking at. And I ask the all-important question, is it happening in our community? What are we seeing happening within the Muslim community that we can say is elder abuse? And are we as community members in a position to be able to intervene in a very respectful manner and say, this is not on?
So I think that's an important discussion to have, and that also goes back to the couple themselves, the younger couple, who now have the reality of an older person that they need to bring into their home. So I think there's a lot of communication that needs to happen that is proactive, that is not misunderstood between the couple that are now going to bring them in. The question again about is it happening? Yes, it is happening. In my 36 years of practice, I can see an increase in it. Okay.
What does it look like? But before you do respond, we've just got a minute to our next ad break, so if we can just wrap up on this thought.
That it is happening. A lot of verbal abuse is happening. A lot of emotional abuse is happening, and that speaks to older people being lonely, right? And not left alone, but being lonely. There's a lot of people around them, but they're lonely because they're not included in conversations. They left thoughts. People think about what to do for them or what they need. They're not asked. Okay, so all those things are important in terms of the verbal abuse. Is the actually verbally abusing the older person, speaking to them like the old woman or the old man is this or that or the other,
or talking
right?
down at them,
or in a very condescending way, you know, like disempowering them almost, so that they sit there and then that's where depression and all of that comes up. Also, dementia, although it's a genetic thing and maybe even hereditary, it is also brought on by verbal and emotional abuse, where
and the isolation.
The person will think, I'll rather now keep quiet, you know. And so verbal abuse, I think emotional abuse is very insidious in many ways, but it happens. And
okay, it is time for our break, and I've just interrupted my dear guest Suraya at that crucial moment, but I promise you we're going to pick up where we've left off and continue this very important discussion on elder abuse. Suraya Nawab is my guest. We're talking elder abuse. This is a follow-on on a previous interview we had with Suraya on ageism, and I think it ties in very closely. There's a very fine line between ageism and elder abuse. So I asked you the all-important question, what type of elder abuse are we seeing in our communities? How rife is it, and how do we put a stop to it?
Okay, so let me pick up from the previous segment and say again a phrase that we learn. I'm not sure whether it's a hadith, but that we learn. And I think it's in the Quran. Rabbil hamhuma kama rabbayani saghira. Oh Allah, let me have mercy on my parents as they had mercy on me when I was young.
Absolutely.
Right? And I think if we can just think about that all the time, because your parents taught you, held your hand and taught you how to walk, taught you how to eat. And now when they are unable to walk or unable to even feed themselves, think about the mercy that they had on you when you needed all that help. They need it now. Also brings me to a very well-known little story on social media, and that always comes around now and then. And it's that little boy with the wooden bowl, where an older parent was living with a family, with a nuclear family, and because the parent couldn't eat or was messy, why? Because their coordination is very poor, and they mess everywhere. So the older person was left on a table with a wooden bowl and a wooden spoon to be eating on his own or her own, and the family used to sit and eat on their own. And it used to happen every day, and that is abuse already.
Absolutely.
Right? The alienation, the separation, the not being able to accept that this older person now is struggling with mobility and things like that. And only to find a few years later that this little boy was playing with a wooden block and trying to make something of it. And the parents asked, what are you doing? And he said, I'm just preparing the wooden bowl because when you get older, I'm going to have a wooden bowl for you.
Oh,
do you
absolutely,
see?
Yeah.
So,
yeah.
and I think that is just, even when I'm saying it, I'm like, having shivers here, because that is what we teach our children. That is the messages the children will get. It's how you treat your older parent is what the children are learning.
Absolutely. So how we treat people around us, apart from our older people, even our children, if we discriminate between them, we're giving permission to outside people to treat the person in the same vein.
Yes, because to them, to that little boy, it was a normal thing. If a parent is older and they're messing on the table or they're not able to eat in a very clean manner and they cause disruption, say, on the table, then you put them aside and let them eat in a wooden bowl on their own so that it doesn't disturb the nuclear family, in a sense. That becomes normal for that child. So when you get older, this is what you taught the child. And immediately in that story, the parents then realized, which is a good thing, that, you know, and in terms of what do we do about it, I think being very sensitive to it, that ayah from the Quran about mercy and mercy to parents, I think being very, very much aware of those things, being very much aware of the fact that you're also going to be getting older at some point, understanding the illnesses, whether it's Alzheimer's, whether it's dementia, whether it's anything that is elder related, right? If you take that as an incentive to learn about it, to learn how you can help the person, so it gets easier for you as well, you know. And so I think those are some of the things that we need to start thinking about, where we are proactive in helping them. The other thing that I need to bring up is there has been an increase in old age facilities, and we spoke about this earlier. The word old age home for me is just condescending. It's like putting them down. It's almost like alienating them. So and so there's a debate also about how do you address an older person? So do you say older adults? Do you say elders? Do you say the aged? And a lot of people take exception to that word, the aged, right? In reality, just in semantics, that's who they are, right? But I think they become so sensitive to the emotional vibe that they get from everybody around them that they don't want to be named, labeled in that way. So I think we need to be a bit sensitive when we speak to them. And even if they're not lending to the discussion, include them. What do you say about this? Or do you know what we're speaking about? Another big problem we find is most people become older people become hard of hearing. And it really frustrates them. And you'll see that they're sitting with you and they'll say, but I can't hear anything you're saying. And then we'll start speaking loudly to them because they're saying they can't hear. But the sensitivity in them makes them feel that we're actually shouting and screaming at them.
And we do, in fact, without realizing, when you raise your voice, already it sounds like you're shouting.
Exactly.
And that brings me to the other issue regarding their medical care.
Yeah.
If they don't have medical aid, in a lot of instances, the children ignore a complaint, a health-related complaint, when an older person says, this is so, that is so, I'm feeling this, I'm feeling that. And you kind of, they get fobbed off with a Panado or some such thing and say, oh, we'll see in a couple of days' time how you feel, and then we'll see whether it's serious enough to take you for medical care.
I think that's another form of abuse. I would say that's actually physical abuse, because you are creating physical harm by not taking that older person to have the medical attention that they do need, right? But again, it comes down to the finances, and then also, I think, like brokers in our community, whether the insurance or financial, in that industry, I think, again, about what can we do, create the awareness amongst people who are now still able, even whether they're 40s, 50s, wherever, where they're still able to start saving for retirement, for their medical care, for their caregiving. There isn't enough of that. There isn't enough of that. And we spoke about the fact that there's a growing number of facilities now being opened up for older people. I also don't think that those should be free of charge, because then they become nothing more than a dumping ground. Because the younger people in the community whose parents we want to now find help for, just find it very easy. go to this place, they'll take care of your mum or dad, right?
No, but I think it does come at a cost now, because
Yeah,
a couple of
it has
years
to.
ago, I know of someone in the community looking for that type of care, and they were quite shocked at the
Price,
rates
yeah.
of having their elder relative being housed there. So there's really two sides to that coin.
Exactly. I think it's important that we understand that, because in terms of that organization or institution, it's important for them to charge, first of all, that they're not just dumping their elderly people there. There's a cost involved, and we know when something hurts your pocket, then you value it a bit more. So I think that's important. The other thing for me there is also that if you are paying towards the upkeep or the caregiving of your older parent, at least that organization will be able to employ caregivers, frail care workers that are qualified to look after your older person who's there. You know, this sort of idea that we have in our heads that all services like this need to be voluntary needs to stop. We need people. You'll have a core group of volunteers. Excellent. I mean, they would go and they'll get their reward for that. But in terms of the residential care, we need to employ qualified people so that then there isn't institutionalized abuse of those older people, because the caregiver or the frail care worker will know exactly how to handle them. For example, food. Another thing is with food. I mean, really, what are they going to eat? So you try and minimize the expenses in terms of what you're going to be feeding the older people. And the institutions need the money to be able to actually have a healthy, balanced diet. People who are in these homes may most likely be diabetic, for example, most likely may be having a hypertension and things like that. So I think even dietitians, there's so much of scope in our community. The other thing is palliative care.
But what about food in the home?
Yes, that's another thing.
That is withheld. Sorry,
Yeah.
again a frog in my throat.
Food withheld, and also food not specifically made for the older person with less sugar, for example, or with a sugar supplement, or not too salty, or something separate for the older folk that they can absorb and that works for them in their medicals, in terms of their clinical care, right? So I think that the type of abuse that happens with elders in the community is still very rife in our community. I think we need to have more awareness about it. Sometimes I think, and we always speak about this instant gratification life that we've become so used to living, it just robs us of that quality time that we can spend with older people who are with us.
I think the all-important question, Suraya, is the Muslim community is very charitable. At the drop of the hat, we will raise millions of rands for any and every charity globally. We need to start looking inward, and we need to see what's broken in our lives, in our homes, and we need to start fixing it. And we need to start by caring for our elderly. But it is time for us to go for a break. Let's take it, and then we'll be into our final segment. We're talking elder abuse within our community. We do know it's rife globally, in other communities as well. And why am I emphasizing elder abuse in our community? Well, simply put, because as Muslims, we are known to be the most caring of communities. At a drop of a hat, we will raise millions of rands in aid, and we will march for all sorts of causes. But we don't realize what's happening in our own homes and the elder abuse that is happening in our own homes. And guess what? You or I may be the perpetrators without possibly even realizing what we're doing. In a lot of cases, it is that, isn't it? We don't stop to think, what am I doing here? And why am I doing it? And it's also about respect, is it not?
It is also about respect. It's also about, again, these busy lives we lead. And sometimes it's just subconsciously we'll say something. Or as we said earlier, we'll dish up for the older person in the home without asking them, would you like this or would you like that? Would you want a cup of tea or don't you? We'll just sort of dish out for them and say, okay, here's your food. right? And so we rob them of the choice that they may have, right, of what they want to eat, what's spread out on the table and what they want. I think before we end the session, the program, we need to talk about the financial abuse of trusts, of monies that are actually the property of the older person, and then the people who are in charge of that money, who are younger now, sometimes misusing.
And absolutely misusing and withholding information regarding the monies to the older person. Actually, let's call it out for what it is, stealing the money of the older people.
So that is happening a lot. You hear of, it's not even stories, it's real incidents where the dad passes away or the older mom passes away, and it's their house, their home, and they asked to leave because the children have something somewhere that says that this home belongs to him or her, and they have nowhere to go, right? So I think that is also financial abuse. That is also withholding information that this home actually, until this person passes on, this home belongs to her or him. And many times older people will do this, would just have a verbal agreement with their children or with each other that this home, you can live in this home until you pass on. When I'm gone, you can stay here. But then you'll find younger people that come in with their own lifestyles and own pleasures, financial pleasures, and would find it necessary. Sometimes it's done not in a very unkind way. Sometimes it's out of need. They're in a fix for something, and they know the mom or dad has a nest egg somewhere, and they'll say, okay, I'm taking this amount to use for my child's education, for example, or anything like that. That is financial abuse, because if this person is demented, they were not going to understand you actually asking them. So maybe just to appease yourself, you'll say, no, I've asked my mom. Mom doesn't even know what you're speaking about. So I think, again, it comes to our Islamic values of honesty, of respect. That is also sheer disrespect in terms of the financial abuse. And you get that even with orphans. So when trustees of estates sort of usurp.
And that's why it's mentioned in the Holy Quran.
There we go again. So everything is there. Everything is in the Hadith and the Quran. I think our lives are so fast-paced right now, and we're getting so caught up in this indulgence that we have in front of us that we're not going back. We're not going back to our roots of learning, which is the Quran and the Hadith. And there's just so much of wisdom there about everything, about the verbal abuse, about the emotional abuse, about the medical and the financial abuse that we spoke about now. You know?
The rights of widows, the rights of orphans,
all
of that is contained in the Holy Quran.
Exactly.
And why are we as Muslims still then going out and perpetrating these abuses against the most vulnerable?
Yes.
They are so, older people are at their most vulnerable.
Exactly. And it's exactly that vulnerability that allows others to take advantage of them. So whether it's in any context that we spoke about, and I think we need to always look at ourselves and say, what am I doing? How can I make this better? Or even be accountable for what you may have done wrong. You know, make yourself account, take responsibility for it, and correct it if you can. You know, even if it's just asking for forgiveness of other siblings or your parents themselves. I think we've become so self-centered that knowingly or unknowingly, we find it very difficult to just take responsibility for what we do.
Talking about responsibility, Suraya, I also find with larger families where there are 2, 3, or even 4 siblings or more, there is this tension amongst them as to who's going to take care of the older parents. And unless money is offered, then perhaps one of the children will appease and take on the parents. But again, there'll be resentment, and the old people are at the mercy of that child. We as Muslims know that what we're doing is wrong. We preach and preach and preach about everything else, but I don't think enough is spoken about elder abuse. How do we address this?
I think we need to pay particular attention to organizations that actually are doing something for this key population group in our vulnerable population group in our community, and I think with each other to be able to speak about it so that it becomes easier. The other thing here is that we're talking about a few siblings together, right? Sometimes one of the siblings won't be able to take the older parent in for various reasons. The house is too small or whatever it is, right? Or it's too far away from a medical facility, for example, or too far away from the other siblings, you know, and they'd have to travel 2 or 3 hours or wherever to get to see their mom or dad. But for me, it's then, if you're not coping, then ask for help. Ask your siblings, ask anybody in the family, ask a younger sister or brother of that older person, an aunt or uncle, to say, I'd like you to help me with this. Or tell your siblings, if you people are keeping mom or dad, but there are weekends when you need to go away, you need to go on a holiday, you need to go out for whatever, and you can't take the older person with, then ask your siblings to say, can you just come and stay here over the weekend, or can we bring mom to you for the weekend because we're going out? I think that sort of understanding between siblings will go a long way in creating the harmony and the peace that we need around this older person, but it also creates so much of muhabba between the siblings themselves. So not one of them feel like we left out, you know, although you're not making the concerted effort. Even if the brother or sister tells you, asks you, can you take her or him for the weekend so that we've got a function to attend? Or I think that asking for help is also this new age of ideas that we have in our heads, that we need to be self-sufficient. We can't ask for help. And that is a whole other issue that we must speak about in terms of how far away from our deen are we going. And not only Quran and Hadith, what about our culture? What about our culture as not Islamically compliant, but Muslims, right? Our culture talks about caring for older people, caring for having the family around you, having that, making the time available where everybody. How often now do we as siblings get together just for nothing? Not a janaza, not a wedding, not any function, just for being together, just for creating that muhabba. And if you're having the older person with you in the family, it'll be nice for them to just meet everybody else,
Absolutely.
right? But it's too much of work for us. It's too expensive for us. We all have our own sort of lives on the weekends and on holidays and so on. So I think there's so much that we can bring to this awareness. And if we just encourage each other to do the right thing, I think we'll go a long way.
And that brings us to the end of the show. Your closing thoughts within a minute, if you'd like to wrap up, please. Okay,
so for me, I think we need to value our older people a lot more. I think we need to take the wisdom that they bring with age, for as long as they are able to converse and be proactive in teaching and guiding younger people. I think we need to be very grateful for that, and we need to give them the opportunity. The one big thing for me is always make sure that your parent is not lonely. I think loneliness just, for want of a better word, kills them.
Absolutely. And there you have it. Thank you indeed for watching. And don't forget, you and I will be in that position tomorrow. I'm talking old age. And it's time for us to mend our relationships with our loved ones, our siblings, our children, and make them know the importance of valuing and respecting the older people in their lives. That's it for today. Thank you indeed for watching. Till the next time, as always, Assalamu alaikum and Khuda Hafiz.